so much for joining us. Whether you're watching online or on TV, I'm Farah Nasser. Prime Minister Justin Trudeau is set to provide his daily update on the COVID-19 situation from our nation's capital any moment now. That is, as you might notice, 15 minutes earlier than usual as he heads to the House of Commons right after it for that emergency debate on the COVID-19 student aid package. And again, the House of Commons returning back in person. Yesterday, we saw a virtual sitting, and this is likely to pass. That is the federal government's third piece of emergency legislation since the pandemic began, and it is all aimed, $9 billion aimed at helping Canadian students. And we're going to hear more about it from the Prime Minister shortly when he does speak. And we have our reporters standing by as well. You see David Aiken there. He is in Ottawa monitoring what the opposition parties are saying this morning in terms of their thoughts on the plan and how it can be improved. We also have Mike Armstrong, who is in Montreal for us as Quebec talks about its reopening strategy. And Silas Brown is in Fredericton to find out New Brunswick's plan and what is going on there. While we wait for the Prime Minister, though, I want to take a look at the COVID numbers for you so you have an idea of where we stand now globally and here at home. We now know there are more than 3.1 million known infections worldwide, but nearly 1 million of those people have recovered from the virus. We also know in Canada, more than 50,000 people have now tested positive and almost 3,000 people have died. Let's go right to Rideau Cottage where the Prime Minister is now speaking.
Hello everyone. Bonjour tout le monde. Habituellement, les étudiants attendent avec impatience.
Usually, students wait impatiently. Their
cours sont terminés.
Of the month of May. Classes are over and there's only a few exams left to write. You're anxious to start your summer job and spend more time with your friends. But this year, things are different. The pandemic is creating a lot of uncertainty and instability for all, including our younger students. Those who are about to obtain their diploma couldn't go to school in the last term, and they have difficulty in finding a job. Those who are still studying are facing obstacles. Work assignments have been cancelled, and summer jobs are becoming more and more rare. You are numerous, asking yourself what you will be doing over the next few months, but how you will pay for your tuition in the year ahead of you. So last week, we unveiled a plan of some $9 billion to help you get through this crisis. First of all, we announced the Canadian Emergency Student Subsidy, which will give $1,250 a month each month to students over the summer. And if you're handicapped or have a dependent, you will receive even more. We also announced investments to create 76,000 additional jobs for students in areas that need help while fighting the COVID-19 pandemic. These jobs are added to those that are often to the Canada Student Program.
Want to contribute in the fight against COVID-19, we're going to make sure you have support too. Students helping in the fight against COVID-19 this summer will soon be eligible for $1,000 to $5,000 through the new Canada Student Service Grant for volunteer hours. We're also going to be providing specific support for First Nations, Inuit, and Métis Nation students. For graduate students and those conducting research, we're going to extend scholarships, fellowships, and grants so your work can continue. And we are doubling student grants for low and middle income students for 2020-2021. Taken together, our government has a $9 billion plan to help students and recent grads get through the next few months. Since we introduced this plan, we've been working with the opposition parties on legislation that will get this help to young people as quickly as possible. I'll be heading to Parliament shortly, where we will introduce a bill to put the Canada Emergency Student Benefit in place. These
last few weeks have been difficult for all of us, and our government is acting to support you during this crisis. To help parents, we will improve the child benefit in the month of May. After the closure of schools, parents have suddenly become teachers, restaurateurs, music teachers, etc. And isolation is difficult for families. Therefore, we're going to give them a little bit of help with the child benefit. And to support people who have a low income, our government will increase the GST tax credit. I would like to remind everybody that if you have taxes to pay, you have until the month of August to make your payment.
The pandemic has been hard on everyone, and that's why our government is stepping up to support you. To help parents who've got their hands full these days, our government will be boosting the CCB payment in May. And to help lower-income Canadians, we supplemented the GST credit. I also want to remind everyone that this year, if you owe income tax, you have until August to make your payment. Yesterday, Minister Hajdu and Dr. Tam provided an update on our latest modelling. And the good news is that Canadians are stepping up to keep each other safe. In fact, in many parts of the country, the curve has flattened, so we have to keep it up. We're seeing some progress because people from coast to coast to coast are making sacrifices and following public health rules, so let's stick to it. Let's stay home, wash our hands, and when we go out, let's stay 2 meters away from others. Starting this weekend in Nova Scotia, the Canadian Forces Snowbirds will head across Canada to salute Canadians doing their part to stop the spread of COVID-19. As we watch the snowbirds fly over our homes, let's remember that we are all in this together. Happy to take your questions now.
Merci beaucoup, Monsieur le Premier ministre. On va maintenant passer à la période de questions, en commençant par le téléphone.
We'll now start with the question period, starting with the telephone. Operator, over to you for questions.
Merci. First question, Stephanie Levitz, Canadian Press. Line open.
Good morning, Prime Minister. Why aren't there measurable targets and standards attached to the national guidelines for lifting restrictions, the guidelines that were released yesterday, so that people can be confident the decisions are being made based on science rather than other considerations?
We worked very hard with the premiers across the country to ensure that we could get guidelines that reflected the foundational science and best advice given by medical experts and scientists on what needed to be in place before provinces or regions could think about reopening. Every region, every province, every territory is facing a very different situation right now with different industries, different size cities, and different spread of COVID-19. That's why we needed to make sure that the foundational elements were there that we could all follow as Canadians, but recognize that different jurisdictions will act differently. But there is a common desire right across the country from all premiers to ensure that we're doing this right. Everyone understands that the danger of opening up too quickly or the wrong way could mean we come back into this situation where we are right now, and nobody wants that. So we're going to keep moving forward responsibly according to the guidelines.
Merci. Opérateur, prochaine question.
Merci. Thank you. Prochaine question, Michel Lamarche, TVA Nouvelles. À vous.
Michel Lamarche, TVA News. You have the floor. Prime Minister, I'd like you to talk about this agreement on the emergency benefit that wasn't reached with the other part, but do you think it'll be longer to have this policy adopted for the students, which was not the case for the two previous ones? And I'd also like you to speak out about the request for financial help. Will you provide the $150 million asked by the League? Well, first of all, I am confident that all opposition parties and all parliamentarians know that we have to support our students. It's an urgent question because students don't know how they're going to find a job for the summer and therefore don't know how to pay their bills, their rent, and their groceries. So we need to support them for the summer period. We also need to support them so that when the school year starts up, they will be able to succeed by going back to school, paying their tuition, and benefit from the work experience that they will have enjoyed this summer. That is why we're talking both about benefit for the students and also by creating summer jobs for students throughout the country to help fight against COVID-19 and help the economy relaunch. I am confident that even though we're pursuing our negotiation with the parties, we all agree that we have to help students, and I know that we'll end up getting the deal done. Now, with regard to the Canadian Football League, we're looking at how we can support various organizations because we do recognize that it's an important issue for them, for the league, and for many Canadians, and so we're pursuing our discussions with them.
We are continuing to engage with various sectors, industries, and organizations who are facing disruptions because of COVID-19. The CFL has approached us about support. We know it's important to them. We know it's important to many Canadians, and those discussions are ongoing.
Merci. Prochaine question, opérateur.
Merci. Thank you. Prochaine question, Marie Vastel, Le Devoir.
Marie Vastel, Le Devoir newspaper. Good morning. Could you please tell us more about the salary improvements for essential workers? You promised to agree with provinces to ensure that these salary improvements would be made. You made that promise the 15th of April. It's been 2 weeks. So what's holding things up since you seem to have agreed with provinces rather quickly for commercial rents? So obviously there's something that seems to be in the way of an agreement with the provinces when we're talking about improving the salaries for essential workers. So what is the problem, and who's holding things up? Well, first of all, throughout the country, all premiers recognize the importance of ensuring that our essential workers can do their job in these very difficult situations that they're facing. So the idea of improving their salaries is a good idea for everybody. But it is a complicated issue because it will be the provinces themselves that will be delivering the program, and they each have different parameters and needs and situations with regard to essential workers. So we're still working out our agreements with the various provinces. It's a little bit different than the agreement on commercial rents, which will be the same throughout the country. This the salary improvement program recognizes the differences between provinces on essential workers, and we know it'll be difficult for everybody. I'd hope to have good news to announce very soon. Last question on the phone, operator.
Next question, Kelsey Johnson, Reuters. Line open.
Thank you, Prime Minister, for taking my question. I'm wondering, is Canada considering mandating meat plants to stay open like the U.S. President Donald Trump has done?
We understand how important it is to ensure the supply of food to Canadians right across the country. And we're watching with interest and concern some of the issues facing meat producers and the supply chain across the agricultural industry. We need to make sure that those supply chains can keep functioning, but we also need to make sure that the people who work in those supply chains and will continue to need to work in difficult circumstances over the coming weeks and months as we continue to battle COVID-19 are kept safe. The priority for us is both things, keeping people safe and ensuring a good supply of food to Canadians. We will make sure we're doing them both together. Okay. Nous savons que c'est très important d'assurer.
We know that it's very important to make sure that the supply chain for delivering food is maintained, but also to ensure the security of workers throughout that supply chain so that we can count on them in the weeks and months to come in these difficult circumstances. So we'll do what we have to do to ensure both those aspects and ensure that food is available for Canadians while yet protecting workers.
I just want to follow up on my colleague on the phone. A few weeks ago, you said you weren't worried about food shortages. Right now, we have McDonald's not able to rely on Canadian beef, and we're not even talking about smaller restaurants or burger joints out there trying to stay alive. What is your specific plan when it comes to the beef industry, and are you bracing for other hits in the food industry?
We know that this pandemic is unprecedented and its impacts are far-reaching on our daily lives, on many different industries. We are working very closely with the agricultural industry to ensure that people get good, healthy food, particularly as we embark upon the summer where there will be a need and an ability to get lots of fresh vegetables and produce from across the country. We need to ensure that we're able to provide for that. We're working with provinces, we're working with the sector. Agricultural Canada is very much on this issue. We need to continue to stay vigilant because of the large disruptions across many different sectors in our country, including obviously agriculture. Nous travaillons avec l'industrie, nous travaillons.
We're working closely with industry and farm workers and collaborating with provinces to ensure that our food production here in Canada can be maintained. Of course, we have to be vigilant because we know that we're living in an unprecedented and difficult situation, but we shall continue to work on this issue as a high priority to ensure that we can feed Canadians.
Minister Janet Silver, Global News. Just to follow on that, given that meat inspected by provincial meat inspectors can only be sold in that province, whereas meat inspected by federal inspectors can be sold nationwide, I'm wondering if you're looking at easing restrictions so that meat inspected by provincial inspectors can be sold nationwide.
I think we're open to all sorts of flexibility, ensuring that we can keep Canadians safe right across the country, but recognize that we are in a difficult situation. But as I understand it, the priority or the preoccupation and the challenges we're facing isn't as much around safety of the food produced, which continues to be ensured, but the safety of the workers working in those plants because of COVID-19. And that is something that requires a little more work and a little more coordination to ensure that we're keeping those workers safe and not just the food safe, which is always a priority for us all.
Good morning, Prime Minister. Salima Shivji, CBC. I want to go back to the federal guidelines for reopening. You talked about a common desire to get this right. Ottawa and the provinces have agreed on this criteria that actually talks about provinces needing to have support for human resources, support for vulnerable people, enough healthcare capacity. Do you think provinces that are pleading for volunteers and calling on the military to help meet that criteria?
These are not federal guidelines only. These are federal provincial guidelines. We worked together, and I think it's something that we need to highlight because it's not often in this federation that the provinces and the federal government can come together as collaboratively as we have, not just on this particular issue, but over the past weeks in working with common goals and common desires to keep Canadians safe. And it really is something to note and to celebrate about Canadians that we are working together so effectively. Provinces have the responsibility of ensuring the safety of their citizens while they look at reopening, and we are comfortable that these guidelines lay out a roadmap that everyone can follow, the principles that will allow them to put in the measures that will keep their citizens safe while looking at reopening various parts of the economy carefully. Okay. I
think we should underline the fact that in a country where disputes between the federal government and provinces are a regular feature, it's incredible to see to what extent all levels of governments are now working closely together. We're united in our desire to serve and protect Canadians from sea to sea. And because of that, I think we can all be proud of the approach that brings us together, not only as governments, but also as citizens. So these principles that we're talking about are not federal principles, they're federal provincial principles. We agreed on them, on these basic principles together. They will ensure that we have proper measures in place before we start reopening the economy throughout the country. And I am fully confident that we will work to protect the health and safety of Canadians and as a priority. Louis Blain, CBC, I'd like to know where you're at and your thoughts about tracing using a mobile app on our smartphones. Where do you draw the line between privacy protection and protection of citizens? And would you be favorable to some kind of a favorable non-compulsory use of an app?
Et c'est une réflexion qui se poursuit.
Very good question, and we are giving that continuous thought. I know that if we asked many Canadians what they think, they would be open to allowing certain elements of information that normally would not be permitted to be shared because of the pandemic and the emergency. But where to draw the line, that remains in the air. Several companies, several countries also are working on approaches appropriate to their circumstances, and we're looking at different possibilities. I do know that as a basic principle, even in a crisis, Canadians are very concerned about protecting their personal information and privacy, and as a government, we share that concern. But in an emergency situations like this, we'll be very, very careful with what we're willing to ask Canadians. It could be to allow people to voluntarily use such an app. That hasn't been decided. It's a matter that we're thinking about as we're considering the reopening of the economy in a progressive step-by-step fashion.
It's a really important question. As to how we can ensure the privacy and data security of Canadians in this situation where we might have to look at new measures in terms of contact tracing and apps that provide more information. Getting that balance right will be extremely important. We've seen different countries around the world with different approaches to personal privacy try different things. We have a number of proposals and companies working on different models that might be applicable to Canada. But as we move forward on taking decisions, we're going to keep in mind that Canadians put a very high value on their privacy, on their data security, and we need to make sure we respect that even in a time of emergency measures and significant difficulty and crisis. We're going to get that balance right. There are possibilities around using voluntary measures, around other things, but every step of the way we will hold true to the values that mean so much to Canadians around privacy and security. These are things that people expect from their governments, and that's what we will stay focused on.
Merci beaucoup. C'est ce qui met fin à la conférence de presse aujourd'hui.
And that ends today's press conference. Thank you, everybody.
That is Prime Minister Trudeau heading back into Rideau Cottage. Very soon he's going to be heading to Parliament Hill, where we have a slimmed down House of Commons. That bill, the $9 billion in aid for students, that bill is going to go through at 2:30. And of course, opposition parties have some concerns with the bill, so they are going to be able to address those in what's essentially a 2-hour question period that will begin with the Prime Minister there as well at noon. And the hope is from the government that this will get unanimous support and then get royal assent and go through the Senate that way, because usually, of course, bills take so long to pass and to go through different readings. Let's bring in Mike Armstrong, because one of the things that was addressed today, and it's really been dominating the discussion for the past 24 hours, maybe even 48 hours with the Prime Minister, was the reopening of some of the provinces, and specifically Quebec, where you are, as opposed to other provinces that are taking a different approach. And Mike, I've been listening to the conversation from doctors and medical experts about school opening, and there has been a lot of concern and a lot of criticism for that and how early that could happen. What is the Premier saying about that, and how is he addressing the reaction?
Yeah, well, we've heard from critics who've said, parents especially, saying our kids are perhaps being used as guinea pigs. That's what some parents have been saying, that there are concerns about staff as well, their health, and there have been sort of precautions that are being taken in that respect. The province's opinion, and many experts, what they've been saying is, we're probably not going to be any further ahead a month from now, 2 months from now, maybe not even 6 months from now. There won't be a vaccine. So if we want to reopen things, the economy, schools, gradually, why not start now? Otherwise, we're going to lose time between now and then. But if you just wait till September, the situation is going to be exactly the same, very likely. So you're going to have the same arguments taking place then instead of now. And this gives us a chance to start earlier, because there is damage being done to the economy, being done to children, children as well who are stuck at home. So why not start earlier rather than waiting till later?
It's certainly unapproached, but we have, we have one of the top medical officials in the province of Quebec calling it a risky bet, and that is obviously alarming to the rest of the country, calling it a risky bet, especially the provinces that are right beside Quebec. Thanks for that, Mike Armstrong. I want to bring in David Akin because we want to talk about what the opposition parties, David, have to say about this legislation that's going through. The draft legislation was sent to them over the weekend, I believe. I think that's the new normal now. So what are they saying? What's the concerns with this $9 billion package?
Right. So it depends on which side of the political spectrum you're on. And it's important to pay attention here because not only is the minority government, where the government will need an opposition party, generally speaking, but because of the special way we're doing this, trying to pass this legislation in an afternoon, unanimous consent of all parties is required. So every party basically has a veto. So the Conservatives, this is the legislation, by the way, to provide $9 billion worth of aid, mostly for students, increased student grants, some student, emergency student benefits, sort of like the CERB, only for students. The Conservatives want to provide more incentives for students to do some work. Essentially, they want to avoid a situation where a student says, listen, I'm getting $12.50 a month from the government. I don't really need to go get a job or to get some work experience. That's the Conservatives' concern. $12.50 a month, I should point out, is not exactly a whole lot of money, but there's a lot of students who cannot find any work or don't have any expectations of finding work. So that's the Conservative side. On the NDP side, they would like to see that this program be extended to international students who remain here in Canada for whatever reason. They may be stranded here. They may be in the middle of a study term. So the NDP are looking to have that. Jagmeet Singh, the NDP leader, did speak to reporters just before the Prime Minister's press conference. And at his point, in terms of where the negotiations are, is anything could happen. So there's still discussions obviously happening. The House is going to convene a special committee of parliamentarians that's going to look a lot like the House of Commons will sit at noon Eastern, and then at 2:30 Eastern is when the House of Commons formally convenes, and that legislation presumably is going to be tabled. So we're getting down to it. There's only a couple more hours really before we expect to see this legislation put before the House.
The other line of questioning that we heard with the Prime Minister was in relation to the food supply. We know Trump has mandated processing plants to stay open. That's not happening here. But the Prime Minister last week just said that he wasn't concerned about the food supply. What are you reading into what he said today?
Right. So I think that the food supply issue is becoming elevated as an issue that the Prime Minister and Cabinet are really going to have to pay more attention to. And here's the thing. It's really, there's a couple of things, actually, and we were reporting on this on the weekend. First, on the meat side, Canada produces a whole lot of seafood, pork, beef, and we export a lot of it. About 30% of what we produce, we export because we can do that. But even though there's a lot of producers out there producing hogs, producing cattle, there is a bottleneck at the meat packing plant area. Why? Because meat packing plant workers are getting sick. They work in close proximity, and there may or may not have been appropriate social distancing steps taken place. So we've seen some meat packing plants go down. The one that's down right now is in High River, Alberta. It's the Cargill plant, and it's responsible for 40% of all of Canada's beef is processed through that plant. There's another Cargill plant in Guelph, Ontario. It has got a worker who's been diagnosed with COVID-19. It's still processing, but if that plant goes down, that's 100% of the halal beef that is processed in this country. Meanwhile, on the pork side, there is a pork processing plant in Breslau, Ontario. That's near Kitchener. And that plant is responsible for 30% of all the federally inspected pork in Ontario. It's shut down for a week because too many workers were sick. So you can see what's happening here, Farah, is that there's just a lot of meat processing plants that are out of action while we're trying to deal with safety of workers. So that's what the Prime Minister was talking about. Want to get these plants back, but he's a little more concerned, it seemed to me, than the U.S. President Donald Trump about the safety of workers.
No halal meat during the month of Ramadan would be a big issue, I'll tell you that. Let me ask you, David, about the last thing that the Prime Minister was asked about, and we don't have much time, but I want to get your take on it. Oh, actually, you know what? I'm being told that we're going to wrap up. I know the Parliament is starting, or that version of it, so I'll let you go take a look at that. Thank you so much, David. The Prime Minister is on his way back again to the West Block at Parliament Hill, where MPs are going to debate the $9 billion student aid package in person. It is expected to pass, but you can find full details on globalnews.ca as we take that live look outside Parliament Hill. Thanks so much for watching. We now return you to your regularly scheduled programming.
Good afternoon and bonjour à toutes et à tous. As usual, I will start with the latest numbers on COVID-19 in Canada. There are now 50,373 confirmed cases, including 2,904 deaths. To date, labs across Canada have tested over 758,000 people for COVID-19, with about 7% of these testing positive. Yesterday, we had an update on the progress that Canadians have made in flattening the curve of COVID-19. We also looked at some of the short-term predictions from our real data forecasting models. Things are looking better, though we're not entirely out of the woods yet. We have to remain mindful that our projections are only as reliable as our actions, now and going forward. If we maintain measures that keep the growth rate down and prevent a rebound, we stand the best chance of remaining on this favorable trajectory. With these promising signs, we are increasingly hearing of reopening plans, but this won't happen at the same time or in the same way everywhere. We've seen that the epidemiological picture in Canada, with slowed growth and bending of the epidemic curve, is actually a composite of very different regional outbreaks and different drivers of COVID-19 spread, depending on where you are in the country. Some areas are seeing very few or no recent cases and have started their gradual social and economic reopening. At the same time, all areas of the country know that there is still a need for key public health practices, like physical distancing when we are out or in the workplace and good hand washing, always. The ability to maintain these preventive practices is an important part of reopening plans for workplaces, schools, and businesses. Other critical public health capacity that must be in place and maintained across Canada is necessary to ensure adequate testing to detect alerts and respond quickly to any new disease activity. Local, provincial, and territorial level plans for reopening are key to managing this next phase. These plans are based on public health criteria and balance the effectiveness of public health measures against their potential negative consequences. Likewise, these measures will need to remain flexible and adaptable to alerts and signals. Although we will be living with COVID-19 for the foreseeable future, we also know that together we can keep this virus at bay by remaining vigilant. Our collective efforts have already slowed the growth of COVID-19, bent the curve, and enabled our health system to cope. These are no small feats, and they tell us we will get through this. Ça va bien aller. Thank you. Merci.
Bonjour. Good afternoon. As usual, I will start with the latest numbers on COVID-19 in Canada. Today, there are now 50,373 confirmed cases, including 2,904 deaths. To date, labs across Canada have tested over 758,000 people for COVID-19, with about 7% of these testing positive. Yesterday, we had an update on the progress that Canadians have made in flattening the curve of COVID-19. We also looked at some of the short-term predictions from our real data forecasting models. Things are looking better, though we are not entirely out of the woods yet. We have to remain mindful that our projections are only as reliable as our actions, now and going forward. If we maintain measures that keep the growth rate down and prevent a rebound, we stand the best chance of remaining on this favorable trajectory. With these promising signs, we are increasingly hearing of reopening plans. But this won't happen at the same time or in the same way everywhere. We've seen that the epidemiological picture in Canada with slowed growth and bending of the epidemic curve is actually a composite of very different regional outbreaks and different drivers of COVID-19 spread, depending on where you are in the country. Some areas are seeing very few or no recent cases and have started their gradual social and economic reopening. At the same time, all areas of the country know that there is still a need for key public health practices like physical distancing when we are out or in the workplace, and good hand washing always. The ability to maintain these prevention practices is an important part of reopening plans for workplaces, schools, and businesses. Other critical public health capacity that must be in place and maintained across Canada is necessary to ensure adequate testing to detect alerts and respond quickly to any new disease activity. Local, provincial, and territorial level plans for reopening are key to managing this next phase. These plans are based on public health criteria and balance the effectiveness of public health measures against their potential negative consequences. Likewise, these measures will need to remain flexible and adaptable to alerts and signals. Although we will be living with COVID-19 for the foreseeable future, we also know that together we can keep this virus at bay by remaining vigilant. Our collective efforts have already slowed the growth of COVID-19, bent the curve, and enabled our health system to cope throughout. These are no small feats, and they tell us that we will get through this. Ça va bien aller. Thank you.
Thank you, doctors. We will now open the line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking a question in the room, we do ask that you make your way over to the freestanding mics. Operator, over to you.
Thank you. Merci. Please press star 1 at this time if you have a question. Veuillez appuyer sur étoile 1 maintenant pour poser une question. Notre première question est de Brigitte Bureau de Radio-Canada. À vous la parole. Please go ahead.
Radio-Canada.
Oui, bonjour, Mrs.
Question.
Tam. We have found many scientific studies done after SARS and H1N1 that state that the wearing of mask, procedure, or surgery in the community is one of the best measures to reduce the spread of respiratory viruses. Is the shortage of those masks the reason that you first did not recommend that the Canadian population should be wearing them?
So we're always evaluating information and data as we have it. Previous studies that have really been based on influenza studies, for example, there wasn't a huge amount of data. However, we had extensive discussions with Chief Medical Officers of Health and recognized that we do want to make sure medical masks are reserved for our healthcare workers. We also want to be absolutely certain that the public knows that all the other measures that we recommended, it still needs to be observed, including those personal hygienic measures, washing your hands, and staying home if you're sick, and keeping that physical distance from others is the most effective way for reducing transmission. But then we felt that as we examined the information, especially given further data on the fact that we have pre-symptomatic and asymptomatic cases that could potentially transmit, at that point in time, we felt that the public in general can consider wearing a homemade mask or facial covering when they can't maintain that physical distance. I have to say that we're ongoingly re-examining that information, and we will, of course, provide an updated recommendation as we get those discussions underway. Thank you.
And one follow-up?
Yes, I recognize, Mrs. Tam, that we were also in an emergency situation, but in hindsight, do you believe it would have been a more precise message to the Canadian people to say that, yes, masks do work with other, medical masks do work with other measures, but because we have a shortage, for now, we should make sure that they go to the health professionals? Would that have been a more precise message in hindsight?
I think that given the evolving data, we knew that the message had to undergo evolution, and that at that point in time, that's where our message was. The chief medical officers felt that we absolutely have to stick with the physical distancing and other measures. This offers another layer of protection from you transmitting the virus to others, and not from you necessarily acquiring, doesn't prevent you from acquiring the virus yourself. So that was also a very important message that we wanted to put out. And so for that point in time, that was felt to be appropriate by the chief medical officers. And again, we're re-examining that data as we speak.
Yeah, it's Dr. Neo, just to add to what Dr. Tam has said, most of the evidence we've had to date, as she's mentioned previously, was based on our knowledge of other respiratory infections, primarily influenza, and how that spread in terms of what masks may or may not be able to do in terms of protection and so on. Certainly with this virus, we're learning that it's not exactly like influenza. It's an infection and a virus that has its own unique sort of qualities and aspects, and that's why we're still accumulating the scientific evidence, and certainly it evolves. And as Dr. Tam has mentioned, I've said as well, the newest type of evidence we're learning about is potentially transmission for people who we call maybe pre-symptomatic, post-symptomatic, having few symptoms, or asymptomatic. And that's why the advice has and the evidence has led us to modify, obviously, as we go along. We're still learning a lot about the virus, and we will continue to be learning.
Thank you. Operator, next question on the line.
Our next question is from Mary Kay Walsh from the Globe and Mail. Please go ahead. À vous la parole.
Hi, doctors. I'm wondering if you can confirm the Imperial College London assumptions that you released as part of the model yesterday. Are those assumptions that are tailored specifically to Canada, or are those a more generic assumption for the entire world or for another country or region?
So they were tailored to the Canadian context, but of course take into account international data sets. Because as knowledge, these are dynamic disease models, so you have to sort of look at the knowledge as they grow. And when you look at the behavior of a virus, includes a whole range of parameters which change over time. So I think those can be adapted, but it's a methodology, I think, that was involved. But it's, again, as we said, it's only one method as well. You have to sort of look at different models in multiple ways to come up with a tool that you can use, and that's one of the tools that we use to estimate 3 different planning scenarios.
And follow-up?
Okay. Yeah, so just to clarify, did your officials tailor the model to Canada, or did the college do that for your agency? And why hasn't the agency conducted its own sort of random sample test of COVID in the Canadian population, so that when we are looking at reopening the economy, we have a better idea of what the disease actually looks like in the general population?
That is exactly the right question. I think that's why there was a formation of the immunity task force, because we know that reported cases is the tip of the iceberg. So the concept is that we would look at antibodies in the population, and the task force work is going to inform how that would be done in the most appropriate and effective way possible. And so we will get some of that information in the next months. I think the other thing is that the serologic assays are still being reviewed in terms of their how well they perform. So that also has to come together, as well as the fact that we have limited knowledge about the immune response to this virus in the population. And so we do not know, while antibody response does occur, how long they last for, how effective that is. And so all of the work is underway, but that will show us more about the underlying overall population that is infected. So that will actually come along. And I think absolutely the agency, together with quite a major group of network of modelers across the country, looks at the different assumptions. They are updated every week, and they calibrate their models accordingly for planning purposes. This happens to be a model that can still work. I mean, you're looking at quite a broad range of attack rates with the epidemic controls, with weaker controls, and with no controls. Those ranges, so they're still relevant for planning purposes.
Thank you. Operator, next question on the line.
Thank you. Our next question is from Lina Ditt from La Presse Canadienne. À vous la parole. Please go ahead.
Dr. New, je voulais savoir,
question, Dr. New, I wanted to ask you this. One criteria that the federal government and the provinces agree on with respect to moving back into a normal phase and having to do with the fact that some people are still in quarantine. I wonder what you feel about the capacity for contact tracing and also for implementing or enforcing quarantine. Also, how do you feel about geo-localizing phones in order to make sure people are indeed respecting these quarantine measures? Answer. Thank you for your questions. Those are excellent questions. What I can tell you is that Dr. Tam and I have been working closely with our counterparts, including Dr. Arruda in Quebec. Among public health experts, we are all on the same page. I can tell you that much. Now, with respect to reopening, clearly the provinces have more data for their own purposes, and they need to use their own epidemiological analysis over time to analyze the options to consider. It's important to have a capacity for isolation, diagnosis, and contact tracing. Given what we've been seeing in Quebec currently, given the lab capacity and what's been happening throughout the province, we, from our end, at the federal level, are noting that Quebec has good capacity. Clearly, it's something that can always be improved everywhere in Canada, but that is in place. And further to that, I think that I said this yesterday with respect to Quebec. There are three things that need to be taken into consideration. The situation is quite particular in Quebec, and it's quite tragic what's actually happening today in long-term care homes. So we need to continue to manage that well, track it, do follow-ups. It's important to do whatever is required in those establishments. Now, with respect to the risk in the rest of the province, it's interesting because the situation is not the same throughout the province. Clearly, Montreal is a center for the outbreak. It's likely not the same situation as in the Saguenay-Lac-Saint-Jean area. So over time, this is something to be considered if you want to do things in stages for reopening. Let's say they want to do something in Montreal. Perhaps the rhythm at which that happens may be different than in other regions in the province. The other question had to do with tools. I think throughout Canada, throughout the country, many people are looking into this issue of tracing, contact tracing. And given technology, as it stands, there are a number of options that are open. There is a group comprised of all representatives of the provinces and territories, and us as well at the federal level. We are currently looking into these apps and their potential. We are continually looking into these options, but we know that it's important to strike a balance between these objectives of public health and also the issues relating to privacy, confidentiality of Canadians throughout all provinces and territories. This is a very live issue, and we're continuing to work on it. Did I answer all your questions? Answer? Yes. My follow-up question is for you, Dr. Tam.
Almost everything, but not my very specific question. I just want to know, what is your assessment right now of the capacity in different provinces to retrace and also to watch over quarantine people? What is your assessment now? Are they doing it well? Not enough? Too much? Are they being able, all of them, to retrace and to watch over the people put in quarantine?
I think, again, as Dr. New said, we work very closely with the Chief Medical Officer. We, again, together look at the criteria and make sure that, one of them is, of course, case detection and contact tracing. I think everyone is looking at their testing capacity, and that is increasing as we speak. We are now looking at, in the next phase, what will be the appropriate thing in terms of expanding testing as well. At the moment, in some jurisdictions, they actually have overcapacity and they don't actually have many people coming up for testing because I think some of the respiratory season is over, and so they actually do have capacity to test for more. And so we're looking at, how do we best go into the next stage as provinces look at their sort of living with COVID, that next phase. So that is actively under discussion. But I think all of us really feel that we have to all increase laboratory testing in general. And some of it is also linked to the fact that we're trying to get as much supply as possible. So all of these pieces are linked to enhancing capacity in the provinces. But I think that all would agree that unless they have those pieces in place, they would be extremely precautionary about reopening or easing any public health measure.
I'm sorry, but my question was not about testing at all. My question was about surveillance of quarantine.
Sorry, Lynn. Go ahead.
I was not asking about testing.
Yes, so you have, in order to detect cases, it's part of the process is actually testing for cases and then looking at the contacts. So based on all of our discussion of the provinces, they have the contact tracing capacities, and we have offered to support where they cannot, and including those who have applied to be volunteering in the federal roster that provinces can tap into. So we are developing a surge capacity to make sure that if more contact tracers, for example, are needed, that they can be accessed.
And Dr. New, just adding to what Dr. Tam said, if your question is about sort of people in isolation, quarantine that provincial authorities have put under, certainly the feedback and the discussions Dr. Tam and I've had with our counterparts, there have been no issues of public health and so on. It's certainly been monitoring people, in quarantine isolation, and there's been, I think, generally across the country, a good, I would say, compliance. People understand the importance that if you are in quarantine, that you're not only protecting your health, but protecting the health of others. And so I think, by and large, everything is going well in that regard. Thank you.
Thank you. We'll now come to the room for a question. Ryan?
Dr. Tam, the provinces have released data on their cases, how many they suspect are from travel, and then also dialed it down to where they expect that travel was from. And despite the focus on it, very, very few of the cases in the country are from China, where we first closed our flights to, and most of the cases are actually from the U.S. I'm wondering if you think the way we closed our borders to international travelers was maybe backwards, given that so few of the cases are from China.
Well, I think as the pandemic evolved and we understood where the epidemiology is, I think the public health measures have been added as a result of the knowledge at the time. So, but we knew at the beginning it was more focused on China, but they were containing at the same time. So we instituted the enhanced screening, focus on initially China, and then as it moved into Europe and Iran. Those were the initial places. But of course, this virus had, in fact, rapidly, I think, spread to Europe, being the next epicenter, and the United States. So in March, we, in very quick succession, first of all, told people not to go on cruises, issued a sort of global travel health notice, because you can't actually tell which country, in fact, the virus could come from, followed by the succession of border measures. And so I think the border measures in terms of other countries, including Europe, followed by the United States. That's how they sequenced it. But I think the implementation of such an incredible sort of policy takes many departments a lot of thinking, but for sure we've been monitoring together with the provinces where the travelers have come from. But I think things actually revolved really, really rapidly, I think, is what was going on. And we were just layering on the border measures as we got the information.
And
but you're right, and we only got, I think, in total about 8 to 10 travelers that were initially linked to China or travel to China or linked to travel to China, and then followed by Iran, where they hadn't actually really reported cases and they were already being picked up in Canada, followed by other areas of Europe, and then the United States.
And then just as a follow-up, do you have a sense in terms of those travelers if most of them were Canadians coming home as opposed to tourists or business travel? Canadians who would have been allowed into the country regardless of what restrictions might have been in place?
I think we will have to get back to you on the beginning, but of course, at a certain point, we actually did not allow non-Canadians or permanent residents to travel to Canada. So prior to that, though, there would have been some travelers who were probably not Canadians, who were here, some of them for to visit or for travel purposes. But those really, actually diminished very, very rapidly, not just because of the actions in Canada, but all over the world in terms of the travel volume going down, the flights not flying. So there's lots of different, I think, aspects to the dynamics in terms of travelers.
Yeah, I can add to that. It's interesting. My own sort of personal recollection in terms of the first cases coming to Canada that were linked to travel from China were actually Canadians or certainly residents of Canada who were coming back. And so what I think is also interesting to add to what Dr. Tam said is that if you look at the border measures we put in initially in terms of the screening, the enhanced screening we had for people coming from China, I think by and large it worked in terms of that specific focus because quite quickly after that, the number of cases linked to travel from China dropped off. But the issue then is that, well, someone says, well, why didn't you close all the borders? And you can imagine in February, would we have closed our borders to the U.S. and every other country? The world is so interconnected with travel from all points, from one country to another. And as Dr. Tam mentioned, what happened then afterwards is that we started noticing cases that were linked to travel from Iran, from Italy. And so that was also our clue that, hey, the world's interconnected and really the virus is spreading throughout. And so it was obviously a serious decision when we, quote, close our borders except for non-essential travel to the U.S. So the other part also I think that we've said previously is that if you look at border measures, they're only one measure. They're only sort of one layer in terms of a multi-system, a sort of multi-layered approach. And really, the most important part is not what happens at the border. It may be an opportunity to educate travelers of what they should be looking for in terms of symptoms, but really it's a good integrated public health and healthcare system. The fact that we have the system that still works well today to be able to detect cases rapidly, treat them, isolate them, do the contact tracing, have the laboratory testing, that's been key. And you can see that our system worked well because we were basically the first country to detect cases before they were even reported in those countries, for example, Iran.
Thank you. We'll come to the next question in the room. Julie?
Julie Van Dusen, CBC. For Dr. Tam, Quebec says it's going to open schools and daycares on May 11th, and considering it's got the highest rate of COVID-19 and highest number of deaths in the country, do you have any concerns about this?
I think, as I've said, that we, together with all chief medical officers, including Quebec, came out with the necessary criteria. You saw that in the statement made by our first ministers, that we all support those criteria, including the fact that transmission is controlled and capacity is in place to detect and isolate. I think all of us have the exact same approach in that we need to be extremely cautious as we come down the other side of that curve. And I think all medical officers, provincial, local, are very much in line with that. They're also trying to look at their own context and balancing out the benefits, but also the potential negative effects, whether it's mental health or otherwise. And they will look at how they cautiously do any of these relaxations, including schools. So, it's best to discuss, of course, for Quebec, but as I understand it, they're not looking at Montreal. They're looking at elsewhere first. And the epidemiology is different in different parts of Quebec as well.
And one follow-up?
Kind of, but my next question is, I guess for Dr. Tam, considering that Canadians are not going to work, they're staying at home, they're staying 2 meters apart, they're washing their hands, and they're not getting on airplanes, how are they getting the infection then? How is it that COVID is still spreading?
So they could be in multiple ways. Not everybody is staying home. Obviously, if you had symptoms, if you're a case, if you're asked to self-isolate, you absolutely must stay at home. The vast majority of cases, the epidemiology is quite different in different places. Some people are going to work. Essential services are being maintained. Some of these essential services, unfortunately, are healthcare settings, including long-term care. And they have workers who work there who are linked to the community. So there may be a number of different pathways at which the virus could spread. And that's why you have to be really, really cautious. But provinces are also looking at whether their cases are linked to specific clusters versus cases that are not linked and that are still in the community. That's a very important part of the assessment as they look at that next phase. They do not want to see a lot of these unlinked cases where you can't trace where they're actually coming from. So that's part of that criteria and the epidemiologic assessment.
Okay, next question, Kelsey.
Thank you for taking my question. I think it may have been partially answered in French by Dr. New, but if I could ask it in English to Dr. Tam. It's my understanding one of the needed elements of getting Canadians back to work is more tracing of the coronavirus, either by people or digitally. So I'm wondering if you agree with this, and do you think automated digital tracing would be a useful tool?
I think Dr. New did touch upon this. It is something that is of interest in a number of the provinces and territories. So we're actually pulling groups together to see what the interests are or the demand might be. I think people have heard that other countries might have used this to good effect. But this is Canada. We need to know that this is appropriate for our setting. And some of the considerations of paramount importance, of course, is privacy. So I think all of that will be taken into account as jurisdictions are looking at the tools, but they are actually quite interested in some of them. And so that's why we're trying to get people together to actually examine a range of them.
Okay, so then as a follow-up, given the interest, I'm wondering, will Health Canada or the Public Health Agency draw up a list of guidelines for what the digital tracing apps must measure? For example, will the apps need to measure not only a contact between individuals, but also how long they're in contact?
I think all of those discussions are currently taking place. So I think it depends on what the needs might be as we examine those apps.
Thank you. We're going to go back onto the line for 2 questions and then come back to the room. Operator, over to you.
Thank you. Our next question is from Stephanie Levitz from the Canadian Press. Please go ahead. À vous la parole.
Good afternoon. It's a question for Dr. Tam. I wanted to ask you about the science behind coronavirus, which is to say that in recent days there have been reports coming out that COVID-19 could be responsible for serious blood clots, strokes, and then I guess in the UK, Kawasaki disease in children. So what's the science telling us in Canada about whether or not this virus is more than just a respiratory virus? And does that change the risk factors in any way when it comes to looking at distancing restrictions for children?
Yes, so I think that the scientific literature is being shared globally, including any observations from the UK. I think that in addition to the response to the virus, it also has been observed that some people have more of the immunological reaction or inflammatory response. So, but we do know the risk factors are still related to your age. So if you are over the age of 60, you're much more likely to be hospitalized. And the deaths occurring in those primarily also over 60, like over 95%, I think, of our deaths, or actually more than that. So serious illnesses can occur, hospitalizations can occur in younger age groups, but they are less likely. But no age group is necessarily spared in terms of being infected. Pediatrics is a very important area that we need to pay attention to. Children, particularly those under the age of 10, tend to have a very mild clinical course, and it appears that they may not be transmitted, the key transmitters in the drive of this epidemic. But coming back to some of these observations, including some of these inflammatory reactions. We are in very direct contact with our Canadian pediatric networks. So through the Canadian Pediatric Society and the Canadian Pediatric Surveillance Program, they have been monitoring, for example, these sort of frostbite-like rashes on kids' toes, for example, or fingers. We've also connected with them about this observation from the UK. In fact, very little is known about this observation in the UK. It was just a general alert to their clinicians. They do not know whether it's linked to coronavirus or not. But viral infections in general, though, do result in some of these observations. But just to message to all the parents in Canada. The cases observed in Canada have been generally mild, and your pediatricians are in very close contact with each other. And so if you're concerned about anything at all, please do reach out to your family practitioner or your pediatrician. They're absolutely they're connected across the country and sharing information.
Thank you. And one follow-up, Stephanie?
Yeah, thanks for that. For the follow-up, I want to go back to a bit of the modeling information you released yesterday when you talked about the goal of viral transmission and how you wanted to sort of see it below this idea of one person infects less than one other person, and then eventually the epidemic dies out. Should a standard like that not be attached to provincial reopening guidelines? There's no scientific benchmarks that appears being used as provinces decide to reopen. Should there be?
Yes, so with the chief medical officers, we are looking at the indicators that are linked to each of those criteria. So right now, and some of the consideration does include that kind of parameter, but it is not a singular indicator. So what we discussed was the fact that these kind of decisions are very important decisions, and they're quite complex. You have to look at all the different criteria and the measures or the indicators kind of at the same time. And no one indicator might necessarily trump another indicator because it's quite a complex decision, and you're weighing out the effectiveness of the measure potentially against any negative impacts, social, economically, or otherwise. So it's not a simple kind of equation where that you just look at a single number. But absolutely, the reproduction number, or the R, or what we call the effective reproduction number, is one element of that assessment.
Thank you, operator. Next question on the line.
Thank you. Our next question, notre prochaine question est de Christine Laflamme de Radio-Canada. À vous la parole.
Question. I'd like to get back to the use of mobile apps for the purposes of contact tracing. The Prime Minister says that he will turn to scientists for their advice. You provide that kind of advice to the Prime Minister. When you look at this issue, do you think this could be the right tool? What do you think of this tool? If there's a way to properly manage some issues with respect to privacy, confidentiality, which is of concern. Thank you for your question. Answer, this is Dr. New. Dr. Tam and I always provide the public health perspective, always based on evidence and science. As to the tools and the apps available on smartphones, this is something that we are looking into. We know what the issues are, but to us, we focus really on what the public health purposes are. Clearly, if we want to have the most effective contact tracing available, then there are a host of options available. But we know that there are also other considerations to take in mind, to bear in mind. We also work with our counterparts in the fields of ethics, etc. It's not simply science and public health that matter. We're part of the conversation in this regard. At the end of the day, that is a decision up to decision makers, and we provide, Dr. Tam and I, provide public health advice. Thank you. Question. But Dr. New, to your mind, are these good tools to use? And if no, do we need to turn to volunteers over the phone in order to do this contact tracing? Is there a chance we might miss the opportunity to contain this disease? I'd like to know what you think. Answer. That's interesting. I sort of have a hat as a public health officer, but I'm also an individual. I am a Canadian like any other. I can understand what the public health objectives are if we really want to have the best possible tools at our disposal to track down absolutely every case, every contact. You just have to think of, if you were only to look at public health objectives, yes, it is interesting what could be available to us through these tools. But as a Canadian, as a citizen, I say to myself, wow, this is something also that I have to take into consideration. The issue of confidentiality is significant to me. Thankfully, I focus on the science, what needs to be considered on the public health side. But I also know that science and public health is not the only issue that is to be taken into consideration in general in order to make a final decision.
Thank you. We'll now come back to the room for a question. Molly.
Hi, doctors. Molly Thomas, CTV National News. Thanks for taking our questions. If most cases today are coming from care homes, hospitals, and food facilities, does this suggest we have a hygiene and health policy failure in these institutions?
So I think, sadly, I think this virus has pointed out some of the areas that we need to do better at. And I think how we support our seniors, the long-term care homes, or other areas where they live needs to improve. And I think people are trying very hard now to make sure that infection prevention control protocols are in place. And so that's absolutely an area that, one of the criteria that we have is supports in place for vulnerable groups, communities and key populations. And those are exactly the kind of populations we're looking at. But also workplaces need to have good plans if they are to continue or they are to think about reopening and according to public health advice. So I think the other populations that we are most concerned about also includes those in correctional facilities, those who are experiencing homelessness, and those who might also be living in what we call congregate settings, where it's more of a crowded condition as well. And so I think in line with this sort of next phase, we need to do better in each of those kind of settings.
Dr. Tam, the Canadian Football League is asking the government for a bailout right now. On the medical side of things, do you think we'll be able to sit side by side in an arena of 30,000 people within the next year? Or is this the end of sports leagues as we know it?
For the next while, I cannot see a single chief medical officer of health across this country who's going to say that these mass gatherings are going to be there. Of course, we'll evaluate things as we're going along, month by month. But when we say we're easing into it, that's definitely not easing into it. So mass gatherings will not be part of our lives for a while.
Thank you. Next question in the room, Tonda.
Good morning, Tonda McCharles, Toronto Star. Dr. Tam, Dr. New just said that, your job is to offer the scientific advice on the use of these contact tracing apps. And you and the Prime Minister today have talked about looking at lots of options. Can you tell me what is the science advice on whether the digital tracing apps actually are superlative to efforts by humans to phone people?
Yeah, and that's why I think it has to come from the people on the front lines who have to do contact tracing, because I am actually working from a bit far from the sort of front line and what will be helpful to them, actually. And so I think people see these technologies as an adjunct to current public health practice, because it is every public health unit and the province actually do this on a daily basis as part of their work on infectious disease. And so whatever we have has to complement the work. It can't sort of probably replace the work. So I think these are some of the characteristics they'll be looking at. If it does make people's lives easier, it makes it more efficient, then that would be important. But some of these apps, as I know the characteristics, and because of privacy and everything else, some of them actually are voluntary. You enter your status, and then maybe other people will know that they are close to you. Just means that it's just another layer. It's not that every case perhaps could be traced using these apps. It's an adjunct. The other concerns are what it's like lab testing, it's sort of false positives where you just happen to, maybe drive by, swing by, pass someone, and suddenly your phone goes bing. Those kind of characteristics is not what you want to have. And because that would alarm a whole bunch of people, they may then show up to be tested, and in fact, they were not at risk. So I think there's so many aspects of these apps that are still needed. But I think the bottom line, though, is the considerations of the people who are on the front lines of public health, who are doing contact tracing and whatever it is that would be helpful to them, I think.
So has Health Canada or the Public Health Agency and digital technology use now in some of the successful jurisdictions that have, put down their first waves of epidemic? Have you done a survey of those apps, and have you concluded what works well as even an adjunct?
No, that process is currently at play, and but it's not just health. Is in our other government departments that's looking at innovation and applications as well.
Thank you. That concludes today's briefing. Merci.